An Alzheimer's care center in Rogers is under scrutiny after allegations of malpractice and lack of quality care for its residents. Before breaking news, KNWA's Lance Lloyd was in studio to show us what a whistleblower is saying about Magnolia Place Alzheimer's Special Care Center.
The Arkansas Department of Human Services surveyed Magnolia Place Alzheimer's Special Care Center in late January after 2 outside complaints were made against it in 2018. The survey found the care center is not only making poor medical decisions, but also putting its residents in harm's way, and it's not only the state that claims to have witnessed these discrepancies.
They're acting outside their scope of practice.
A former employee, who we'll refer to as Julie to protect her identity, says Magnolia Place Alzheimer's Special Care Center is facing many issues.
There have been people that have family members that have moved their loved ones out because of the staffing, because of the lack of care, because of the lack of accountability.
Julie says she witnessed other workers bringing children to work, medication errors, medical staff who weren't qualified, and several deaths that occurred that were out of the ordinary.
There's really no accountability for making sure that each person gets their medications. There's no accountability at all. There's also staff there that is not qualified. They've not been through caregiver training.
According to Arkansas regulation for Alzheimer's Special Care Unit, caregivers must complete 30 hours of initial training followed by 8 hours of in-service training annually.
There have been several falls with major injuries there. As their health declines, it's not being caught quick enough. So by the time they get to the hospital, the patient passes away.
We attempted to speak with administrators at Magnolia Place, but they declined to go on camera and instead released this statement saying, in part, quote, "We were disappointed to learn that someone has called into question our commitment to our residents and the care that we provide to them. Although we have been provided with little detail regarding these reports, we take them seriously. We have reviewed them and believe them to be unfounded."
They don't want staff talking to family members, telling them what's going on or what isn't going on.
2 complaints were filed with DHS against Magnolia Place in late 2018, but were deemed unsubstantiated. The DHS then surveyed the facility in January and found several discrepancies, like employees not having job descriptions, kitchen staff without proper facial hair covering, and housing residents that require a higher level of care than Magnolia Place can provide.
All of those things all affect our residents. Everything that goes on in that building, that's their home. That's where they live. They pay a lot of money to live there. They deserve the care.
Now, the DHS says Alzheimer care units are required to keep annual health surveys accessible and available when requested by the public. They are also required to follow a plan of correction to fix any issues. In studio, Lance Lloyd, KNWA, Northwest Arkansas News.